And welcome everybody to the 12 o'clock show with Mayor Joe. Joining me today is the Health Commissioner from the Franklin County Department of Health, Joe Mazolla. Joe, thank you for coming in today.
Thank you for having me, Mayor. It's good to see you.
Twice the Joes on the 12 o'clock show with Mayor Joe. So we've got to, you've probably been bored the last couple of years, right? COVID's not a big issue anymore. There's no health concerns, stuff like that. You're just kind of taking it easy, or is it still kind of a whole different world out there?
It's kind of a new reality.
Mm-hmm.
We certainly are now living with COVID-19. We'll probably talk more about that. But in public health, there's never kind of a quiet time.
No.
So now we're in respiratory season, respiratory virus season, and there's always something to be concerned about. And so we're definitely very busy still at Franklin County Public Health.
So when we talk about winter sickness, obviously we got COVID-19, and we'll talk about that in a little bit. But you mentioned a little bit of that, the respiratory. Is that kind of what you're seeing now in general? Is like that's kind of the focus area in addition to COVID, that you're seeing that more so than, say, the flu? Because I've heard people talk about it, but that RSV seems to be the one that most people are talking more about.
Yes, and so we are seeing an uptick not only in COVID, but in influenza and RSV, and so definitely want to make sure we continue to highlight the importance of taking preventative measures regarding RSV, those little ones, and of course individuals older than 60 as well. But respiratory virus season is here. We're now in the middle of January. We're seeing that. We're seeing hospitalizations start to increase a little bit. And so we want to just make sure we continue to emphasize why it's important to stay up to date on your vaccinations for all of those vaccine preventable diseases, and then also take those extra precautions about staying home when you're sick, washing your hands, and all of those extra preventative measures.
I think that's one of amongst the many things that kind of came out of COVID is this idea about people not knowing how to wash their hands. Which is one of those things, like the more you think about it, the worse it gets, just because you don't know any of these things. But you mentioned the V word, vaccine, so I just kind of want to ask a little, where are we at in terms of vaccines for COVID-19? And obviously the flu vaccine, I know that changes every year, but where are we at in general for the COVID vaccine right now?
Well, right now, in terms of uptake of the updated vaccine, we're not where we need to be.
Mm-hmm.
Our best estimates right now is about 20% of individuals have received their updated COVID-19 vaccine, which is about half of what our population has in terms of the flu vaccine. So we have about 50% of our residents that are getting their flu vaccine, which is not where we want to be either.
Yeah.
But when we look at COVID-19, we're really concerned about that. We're concerned about our residents not taking the opportunity to stay up to date on their COVID-19 vaccination. We know how important that is to prevent severe illness and obviously death. And so we really want to continue to stress that, making sure that we have opportunities for our residents to get up to date on their COVID-19 vaccine. It's never too late to do that. Yeah. But when we look at COVID-19 and then we look at influenza, we want to continue to stress the importance of staying up to date on our vaccinations there. And we're working with healthcare partners. We're working with our other partners across our health jurisdiction. But we certainly have got more work to do. And understanding, there might be some vaccine fatigue. I think we absolutely get that. But we also want to really just stress the importance of the effectiveness, the safety of these vaccines, and really why it's so important to stay up to date. And so we're making that case, continue to make that case every day.
Well, I think, and it's interesting because, everybody, obviously at the height of COVID, even when we were having our, Zoom, meetings, even in the early stages of it, everybody was very much well aware of what the vaccine was. We were having, the vaccine drive-through services and all of that stuff, and there was such more of an emphasis. Now, I don't want to call. I think it's almost like an out of sight, out of mind. Like if you don't know, or if it's not something that's just jumping right at you, then you're like, oh, I didn't get that. You go. People go in for their annual exam, or maybe they have a cold and they go to the doctor and they say, well, did you get the new COVID vaccine? And they're like, there's a new. They don't necessarily know. Where I don't think, unlike what you said with the flu vaccine, I think everybody's kind of in that mode that even if they're not using it, they're at least aware that that the flu vaccine is here. We did that here in the city. We offered the COVID vaccines and then the flu vaccines for staff and employees and things like that. I want to say October-ish, November, somewhere around in there. Everything in 2023 is now a blur because we're already moving so fast into 2024. But now you mentioned washing hands. Are there any other things that are out there that you could sit there and say these are your best ways to keep healthy other than washing hands? Which again is a huge thing. Please do it. But what else would you suggest?
I think the number one thing is really just paying attention to symptoms and staying home when you're sick. and not taking that risk.
Okay.
I think that's one thing that we've seen a lot of is individuals, just maybe saying, well, I don't feel great, but I'm going to go into work anyways, or I don't feel quite myself, I'm going to go to that event anyways. And then all of a sudden, someone has mild symptoms, and then they test positive for either COVID or maybe they have flu or have you. And then all of a sudden, we see the spread within the community. So I think that's the biggest thing, is really paying attention to those symptoms and taking those extra precautions there. I think we need to continue. I was telling you earlier, I read in an article, the emergency may be gone, but the risk is still there.
Yeah.
And so taking that extra step to be cautious about if you're not feeling great, if you have symptoms that are consistent with COVID or flu, just stay home and protect yourself. Get rest, take care of yourself. And make sure that you're taking those steps so that you're protecting yourself, your family, and the community.
And that's right. I mentioned that I had gotten sick in between Christmas and New Year's, and so it was one of those things where, outside of payroll, I came in to get that done because, that's kind of important. But outside of that, normally I am not one to take a lot of time off. This is like an old teacher habit with me. A lot of times I felt like it was harder to take a day off as a teacher than it was to actually just, get well. But I agree, that's something that we all have to do, whether you call it self-care, whether you just call it letting your body kind of adjust to things. It's good advice.
And I think one other thing that maybe, some have maybe just thought about, not a lot about, is, wearing a mask. It's okay to wear a mask if you are in and around crowds, and if you want to maybe take that extra precaution, even if you are not sick. If you're in a large group, or if you're in an environment that maybe you have a little bit more risk of being around others, I think that's important that we can be mask friendly still.
I agree on one condition. This is my condition. This is not your condition. If you're going to wear a mask, and your mask is like this, I don't think that works. Is that like it doesn't work if the mask isn't there?
It does not work.
Okay, I'm just making sure, because
a well-fitted, proper mask, I think, is absolutely.
There are some times that I just look at them and it's like, can you just take the mask off? At this point, just stop. So moving forward, obviously we're in 2024. Are there any big initiatives that Franklin County's Department of Health is going to look at this year, other than obviously, making sure people are aware of various vaccine options and things like that? But is there anything specific that you're looking for?
Well, there's actually several things, and I'll try to do my best off the top of my head to talk about them, but we're really excited about some upcoming initiatives, and it really starts with our new Community Health Improvement Plan that we adopted back in August. I think the last time I was here, we were still working on that plan, but that plan has now been finalized by our Board of Health, and we're really excited about how that's going to be a guiding post for us as we kind of approach the next 2 to 3 years in terms of our public health efforts here in Franklin County. A couple things that would come to mind. We're expanding our vaccination clinics across Franklin County, looking for opportunities there. In terms of home visiting, we have partnerships with community health centers to do more home visits within Franklin County in our health jurisdiction, which we're very, very excited about. Tobacco cessation, really wanting to make sure we continue to, maybe we'll talk about tobacco and vaping. Really kind of stressing how we can continue to emphasize the need for prevention and cessation for tobacco and vaping. And then as I kind of think about, some of the big picture items within our Community Health Improvement Plan, continue to support our Columbus and Franklin County Addiction Plan. We have a CDC grant that will allow us to do that for the next 5 years. We're thankful for that funding. Maternal and child health, I talked a little bit about that. Infant mortality continues to be stubbornly high, and the disparities there are just unacceptable.
Especially in Central Ohio, which is typically not viewed as an area that is has abject poverty in multiple locations. But there's such a disparity right now, especially with our people of color populations, and black women specifically, and their infant mortality rate is just atrocious. And I know that there have been plenty of people at the county that have made mention of it, but it's shocking to me sometimes to see how bad it is when you start looking at the actual numbers and data.
It is, and I certainly am grateful for the opportunity to work with Celebrate One, which is the collective impact organization that's leading that work, and we're going to continue to stay laser focused on that. That's identified in our Community Health Improvement Plan as well. So infant mortality and maternal mortality has also been something that we are very focused on. I mentioned mental health and addiction in the Columbus and Franklin County Addiction Plan. The other priority within our community improvement plan is racial equity. And we have an equity advisory council that we've convened now since 2020. That group will continue to be a very important coalition for us to really guide our efforts as a health department and as a community. So those, that's kind of the big picture, and now we have this plan, and we're really aligning efforts there. Within that plan, we also talk a lot about social determinants of health, housing, transportation, education, access to healthy foods, and really thinking about how can we align our work with those efforts there as well. From a policy standpoint, we're certainly working with our local communities, our cities, townships, and villages to see how we can support those policies.
Until the state comes in and says no.
Well, until the state, and we could talk about that too.
Yeah.
Very, very frustrated with some of those discussions. However, we are really grateful to what we can accomplish here locally, and I think that's what we're gonna stay focused on. But yes, you're correct. There are some things there that are kind of slowing down some of the work that we're doing here locally. And I do, before I forget, I want to thank you and the City Council for your commitment to some of those policies. The tobacco retail licensing policy that was passed last year. Really grateful for that. We have 5 other communities that have done that, and we know others want to do that.
Yeah, but now we're all having to sit and wait.
Now we're having to sit and wait about if we're going to be able to have that authority.
I get a kick out of it because when I think of Ohio, one particular crop that comes to mind is corn, soybeans, things of that nature. One thing that never comes to my mind is tobacco, and where the tobacco industry in itself has so much sway that for these 5 communities and potentially other ones that would want to prohibit, whether it's just licensing tobacco retailers or whether you take that to that next step with menthol or flavored tobacco and things of that nature, which ultimately I think that was where a lot of people were going to go, which is why I think we're in the situation where we're at right now, where the state, for whatever reason, check your campaign finance forms and figure that one out. See, I can say these things, you don't have to worry about it. But that's where it's coming from. And because we're not Virginia, we're not a tobacco growing state. We're not, in the deep South where that has been a prevalent thing. But for some reason here, it's the case. And then from just a grander standpoint, this is another example of the lack of what we all like to laughingly refer to as home rule. There is no home rule. It's home rule unless we don't like it, and then there you go. And so that's one of the things, whether it's, the issues with guns in our communities, and, the city of Columbus is obviously trying to take their steps in it. We had a step when it came to gun violence in our community that we cannot move forward with because of a lawsuit that was going on there, the uncertainty with the tobacco lawsuit, and then ultimately, how does all of this impact, especially with issue 2 passing, and the state is taking its time to figure out all the ins and outs of that. How is that going to impact everything down the way? I think we either have home rule or we don't. This in-between thing, or this let's pick and choose what we want to believe in, is not necessarily the best manner to go, because I would assume that from your point of view, you know what's going on the ground in Franklin County. You see it. You can probably cite statistics and data and the health impact and all of this stuff, because that's what your world is and that's what you live, and therefore you and your organization are in the best position to make those kind of recommendations. Much like Reynoldsburg, we tend to feel like we know where our community is on those types of topics. I don't know if everyone at the State House who maybe has never driven into Reynoldsburg, or really outside of driving to the State House, might not even be familiar with Franklin County, making decisions based on what they feel is appropriate or their campaign donors feel is appropriate for everyone else. There's my editorialization. It's only one of a bunch of them today, but we'll just go with that.
Well, I certainly appreciate all of those comments, and from a public health standpoint, I think having that ability to make those decisions locally, I think, is fundamentally important for us. And being able to work with our elected officials here in Franklin County, I think having that authority and having that ability will remain a very important tool for us as we kind of think about how can we improve the health of our community. So I'm hopeful. I remain hopeful that authority will continue. I'm grateful for the governor's veto for that, and I'm hopeful that will not be overridden. Though I can't do too much on the advocacy front, I can just say that I am optimistic, and I'm looking forward to being able to work with more communities to make sure that we're protecting our community.
Absolutely, and I also feel, in my opinion, that If it ultimately is overridden, then it's the next person up mentality that we will take on whatever we are then allowed to do, and then we will make corrections for that, because ultimately the struggle for public health doesn't end because of something that happens at the State House. We'll just move on to the next and try and figure it out.
That's right.
Now, Franklin County obviously encompasses, most of Reynoldsburg. We have a couple of others as well. But if residents want to know, what can Franklin County Department of Health do for them specifically, other than some of the things on there? What can they do to kind of get an idea of what you can do for the residents of Reynoldsburg specifically?
Sure. So I would encourage residents of Reynoldsburg to go to our website. There's lots of information there and there's actually a drop down for residents there.
Okay.
And you can see all the different topics that we are involved in that will be of assistance to our residents. A couple things that would come to mind. Right now, we are offering a free healthy home assessment for our residents. So residents can contact us and get scheduled for that. We can work with family to make sure that their home is safe and healthy. We also have community health workers who can work with them on any number of different pathways, whether they're looking for resources for transportation or education or housing. And so our community health workers, a great team of individuals who can help them. I mentioned tobacco cessation. If there's any concerns about addiction, other efforts there. I mentioned home visits. So if you've got a newborn, certainly, or anything along the lines of maternal and child health, our public health nurses are great to work with. And so I would just encourage folks to go to our website and take a look at that and see if there is a resource or if there's information that we can provide to them. We certainly want to do that. Also want to mention something you mentioned about big picture, if I could. We are 2 years into a grant now. Well, we're looking at health literacy as a strategy here in Franklin County. And Franklin County Public Health is working with our colleagues at Columbus Public Health and also Nationwide Children's Hospital and any other partners to see how can we work together to really improve health literacy in our community. And so we're doing a lot of trainings with healthcare providers, doing a lot of trainings with social service agencies to really improve our ability to communicate, use plain language, use culturally and linguistically appropriate language, and really connect with our community much more effectively. So that's something that's been a great opportunity for us. That's in our Community Health Improvement Plan as well, and that work will continue. So there's some training opportunities coming up. So whether you're a resident, whether you're a provider within the city of Reynoldsburg, there's definitely resources for you, and we certainly want to hear from you about how we can be of help.
All right, sounds good. Any questions that have come across?
We have one. It says, "Good morning. With our property tax payments, what percentage of the funds stay in Reynoldsburg?"
That's a really good question. I'd have to break it down. I know a majority of property taxes are dedicated, obviously, to your school districts, and then you're going to and again, depending on the county, obviously some's going to go to Franklin County Department of Health, and then you've got fire agencies, you've got MRDD, you've got the library, and probably like a dozen other types of things. I know the city, I think we get like a penny out of every $100 or so. The cities don't get a lot in property taxes. Everything else goes on. That is a good question. I'll reach out to Auditor Cinziano's office. I know the number is, relatively impressive when it comes to that, because you guys have to have funding to do what you need to do.
We do, and we're grateful for that. At the health department, we work with all of our cities every year to renew our contract there, and so certainly appreciate that as our local dollars. And as a health department, we have actually been working to really expand the resources that we have, not relying as much on our local dollars, because we know that those dollars are always, there's always so much to go around there at the local level. So being very proactive in terms of state grants, I mentioned some of those federal grants that we have. So really looking at other opportunities to bring more resources for public health to Franklin County. But we're really grateful for the local government dollars that we have from our cities, townships, and villages.
I think from just a strict budgetary standpoint, we're probably approaching about $400,000 is what our typical contribution is. And I guess the easiest way to kind of do that is obviously those services that you had mentioned. But we also have the mosquito spraying. We also have a relatively new thing that's going on, the plumbing inspections and things of that nature, because obviously of concerns of lead pipes and things like that, which Reynoldsburg does not have a lot of. It's actually very limited in most cases, which is good. It's like, well, that's one problem we don't have. But those types of things. So I think that's where it is. So it's around $400,000 of like actual city budget that goes into that, and it hits a number of those different types of things. It's a good question.
Yes.
All right. Do you have a few minutes to kind of stick around for everything, or if you've got something to do, by all means, you're welcome to.
No, I'm good. I'm good. I would maybe just one more comment there. Next week we're having a big event on January 23rd, which I know you're going to be a part of, and I want to thank you for that. So we have an annual event for all of our community health action teams and what we like to call chats. And so we bring all of our chats together twice a year now. But these are our local kind of community-based coalitions that Franklin County Public Health supports to really think about how can we align our work at the community level. And so we have an East Side chat, we have a chat in Hilliard, we have a chat in Clinton Township. So we have 7 of these chats across Franklin County. And so the event next week, next Tuesday, is we're inviting all of our chats, but we're also inviting our residents to join us. We want to hear from our residents. We want them to be part of our public health planning. And so it's an all-day event. It'll be an opportunity for us to really, as a county, kind of have a bigger conversation about where we're going, how we can support our local chats, and I want to thank you for being a part of that panel. Looking forward to talking with you and also our Prairie Township administrator and our fire chief in Clinton Township is also going to be part of that panel. So thank you for that support there, and always looking to align our efforts between our chats, our local communities, and then certainly all of our other public health partners across Franklin County. So
looking forward to it. Anytime that I can, occasionally leave the city of Reynoldsburg for something fun, it's always it's a rare thing, but it's a fun thing.
Yes.
Well, I got a couple of things that I kind of want to go through. Obviously, it's been cold, and we know that the schools had a cold day today in Reynoldsburg. But a couple of questions had come out. Every community has homeless people, and our community actually, depending on how the numbers go out, we have identified roughly between 20 and 30 individuals that are within our community on a regular basis that are without a home. The rule of thumb is that you times that by 3, and that's probably the real number that you get to. So we're looking anywhere from 60 to 90 individuals that are there. Our social workers do a great job of going out and talking to as many homeless people throughout the community as we can to offer options. Some of our community are homeless because they have issues with mental health or drug addiction. Others are because life has happened to them and they have not been able to figure out necessarily how to kind of recover from that. A few of the individuals that are there, and depending on what time of day and when you travel, you may see them actually on Main Street. There's an individual there where we talked about people were asking, do we have warming centers? Do we have options for this individual? Please know that unless something is unusual, most likely our social workers or our police department have made contact with anyone that they see, especially in these kind of extreme conditions. And it's not just the extreme cold, it's also the extreme hot in the summertime. Sometimes they accept those offers of help. Sometimes they do not. And we cannot force them if they are doing something that is not, if there's no legal issue there, we cannot force them and detain them and put them somewhere, even if it in theory seems like that's for their best interest. So please know that we are aware of it. We do look at it. Sometimes they take us up on the offer, and those are the ones that you'll never notice because they're not there. Those that do not take us up on the offer, you will see there during this particular point in time. The one individual that I'm referring to is actually being very, very nice. He just thank you, but no thank you. He's fine, and just the way things are. And it's not just the city that's been offering. I mean, even just some random. I saw somebody actually talking to him earlier today. It's an unfortunate thing which relates to a lot of other things that I will be talking about in my State of the City address on February 15th. It's going to be right here at City Hall. The doors are going to open at 6:30, so you can mix and mingle and see some of the things that we've got going on in the city between 6:30 and 7. And I will start as close to 7 o'clock as I can. I'm usually pretty on time with these types of things. And then I'll do a little question and answer session afterwards. Sometimes people like to, ask a few different things. Other times they're just done and they're ready to go home. But we welcome everybody to City Hall on that, so you'll start seeing that promoted in the next couple of weeks. In the meantime, we do have some news from Reynoldsburg City Schools. They have their board member office hours. So this is actually a fun thing. I wish a lot of districts would do this. Our board members, they'll rotate around, and then they'll be at what we call our Welcome Center, which is our old Graham Road Elementary. We actually had one of the vaccine or the COVID testing clinics right at that location. And they'll be there ready to answer any questions that you have about anything going on within the school district. So our first one this month is January 22nd. It's at 4:30 p.m. And President Angela Abram and Vice President Jenny Quesenberry will be there. And then a little bit later on the 31st, at the same location, at 5 p.m., President Angela Abram and board member Mandy Young will be there. I had the privilege to talk to the board last night a little bit about School Board Recognition Month, because school board members have a lot of responsibilities. They had a lot of responsibilities before COVID. Certainly after COVID, there's even more to kind of add to it with some of those challenges. So they do a great job. It is not always the easiest job to do. And I'm not saying that I had anything to do with calling the cold or not, but one of the things that I did is I listed all the other things that board members have the responsibility for. And the one that I did not list was whether or not they could call off school. So that is not the board member's responsibility. But the students that were there, I was kind enough to inform them that the superintendent is the one that makes that call. And I know Dr. Reed was thrilled that I specifically pointed to her for that one. And then miraculously, after the board meeting was over, school got canceled. I don't know. I'm always an advocate for that type of thing. So moving on from that, we have some code enforcement topics. We have our C-Click fix, which is, and some communities have it, they have their own little name for it. Basically, if you're walking down the street and you see a street light out, you can take a picture of it and then go through an app process, and then it'll report to code enforcement so we can get those issues identified. This will go live in less than 30 days. We're doing, the early beta testing version of it. So if you just happen to see some people from the city walking around with their cell phones, they're not wasting time. They're actually trying to make sure that everything works and is routed the same way that it's supposed to. And because of winter weather coming in there, we do have kind of an update. We're making a change to our snow policy this year. Most of the time, I think our snow warriors do an amazing job, and our community members think that. But we're going to try and step up the game a little bit. So basically, anytime that it snows and it's 2 inches or more, we're going to make sure that our plows are out even on the residential streets. So that is going to be our goal this year, is to clear out as much as we possibly can. Obviously, we're going to get out a little bit before and pre-treat and things of that nature. The only thing that I ask of you is, as best as you can, please get your cars off the road. Just move them into a driveway, or this thing, it's a little box thing that goes into a house a lot of times. It's called a garage. I know that there's always a lot of stuff in it, but if you could park in the garage, that's always helpful as well, just so that way it's easier for the snowplows to kind of go all the way through. And I did get some questions over the weekend about Main Street and traffic lights. So this is so we did this entire Main Street project that was primarily focused back here, but it was all the way across when it comes to syncing all of the traffic lights to help traffic flow. We also added an Opticom system, so our emergency vehicles could go through and it would just turn green and go all the way. So it is in effect now, and sometimes it doesn't always work right. So I learned a little bit over the last couple of days to figure all that out. The system typically is turned off as far as the synchronization process between 9 p.m. and 6 p.m. because usually those are not high traffic times, from 9 p.m. to 6 a.m. So there was an individual who had actually mentioned that they leave their place of work relatively late at night, and at that point in time, there's nothing more frustrating than sitting at a red light and you're looking and no one's coming, and you're being a good person and not going through the intersection. But that typically that system is off at that point in time. It reverts back to the radar thing. So that basically you pull up to it and then it'll kind of click, or it'll be on a timing system. And if your luck is anything like mine, your timing is so great that every time that you pull up to it, even though you think that there's no one there, automatically goes the other way. That's just kind of the nature of things. The other thing that may kind of unsync some things during your regular, I guess you could say 6 a.m. to 9 p.m., is if an emergency vehicle does go through it and they have to preempt the system all the way, it may take a couple of cycles to get the system back in so it's all coordinated. So there's times where if you see emergency vehicles go by, it may not necessarily be there. So you may end up getting stopped a little bit at a couple of intersections at a time, but that's because of something happening just relatively recent. So I found that was good information to know, so I wanted to share that with everybody. I don't know about you. Do you play euchre at all?
I do.
All right, so I don't think there's much room. I think they have one spot left for our adult euchre league here that we're working with one of our local breweries. But we have all sorts of those things. We've got cornhole, bingo night, daddy-daughter sweetheart night. We've got puzzle palooza, tumbling, safety town, in addition to all the athletics for the summer and spring. So you've got soccer, you've got baseball, softball, and then what we have are superhero versions of it. So for those that are of limited mobility or just making sure that we give everybody an opportunity to participate in athletics, we have that going on. So that is going on right now. We're also excited. Bryce Park, finally. I love dealing with the City of Columbus. I can only imagine how much fun you have dealing with them at times. The City of Columbus, we are working with them on right now it's currently a stormwater facility right across the street from where the new library is being built. So we are actually going to be redesigning that entire area and making it into more of a passive park. So it is going to be advertised next week. and then it's going to be put out to bid. And we'll have our bid opening sometime, I think, the second week of February, which means that we should have a groundbreaking date not long after, so we can finally start getting that done, because all the lawyers had to dot their T's and cross their I's and then come up with other things to do to elongate the process. But we're really looking forward to that. As far as development goes, always right now this is the most exciting time of the year because everybody's dreaming big, and we have people coming in and said, hey, what about this? What could we do there? I'm not going to tell you anything today because I have to have something for the state of the city. But we do have an opening for a member of the Planning and Zoning Board. So if you're interested in that, please send a cover letter and resume to Eric Meyer, who's our Director of Development. Planning and Zoning is the group that actually kind of comes in, and when somebody has a proposal that they want to talk about, that they make sure that, aesthetically it looks right, it's zoned properly, and all of those different things that are going on. Not the most exciting of things, but it's incredibly needed, because what you don't want is you don't want to have something like a few years ago, there's a house off Retton that apparently got through a loophole of something. I think and the garage is not in the area where you would think a garage was, and that the house looks completely out of place from a bunch of like one level type of homes. But because of the ambiguity of the old zoning code, they were allowed to build a 2-story home with, I think, the front entrance, I think, is on the west side of but the garage is somewhere. It's one of those things you look at and go, it's kind of like when you have like a 6-year-old drawing their first house. That's kind of what it looks like. It's a great house, but it's just odd shaped in there. But that's something for there. We also have the Adopt a Road for 2024 that is going on. So we have a number of organizations that go out and actually help clean up our community and things like that. And we provide all the utensils, as it were, the trash pickers, garbage bags, and stuff like that. I do want to give a special shout out to our entire events team here in Reynoldsburg, Jennifer Clemens, who hopefully is watching. Hi, Jennifer. The lights are really bright, by the way. But we have Jennifer Clemens, Nadia Miller, and Councilwoman Shawnette Strickland helped put together a really great show for our Martin Luther King breakfast this past Saturday, and the Reynoldsburg Community Church was great, and Lindsay Catering did a fabulous job. At least I am told. I did not even get a chance to eat because we were doing so many things all the way across. But let's put it this way, there wasn't a lot of food left when it was all said and done. It was a great thing. Gave away some scholarships sponsored by Victoria's Secret, one of our biggest employers. So that was fun to see. A couple of 3 students got their awards in there and all that. So it was a great community event all the way across. And speaking of community events, before I see if there are any other questions that have kind of come up, we have a Franklin County prosecutor race that's coming up, and there's a number of candidates are there. And I know that one of the local organizations in Reynoldsburg is looking to host a Meet the Candidate night, just to kind of get an idea. Franklin County prosecutor is a huge thing. We've seen issues with juvenile crime and how that is impacting everything. So I may have some more information on that about a local organization that's going to bring together those candidates to actually come and talk to our community about what their thoughts are on it and what they would do if elected to those positions. It's important. We also have a state house candidates that are in there that will impact Reynoldsburg as well, because I think it's important to bring some of those people in so the community can actually hear what they have to say about it, because we all have to deal with it eventually. So, any questions that have come across in the last little bit? No? Okay. Well, that's impressive and sad a little bit of the time, but we'll take it. How about you? Any questions?
I don't have any questions. I did have a couple comments, though. I have to tell you, I went to the Tomato Festival this year, first time, and we had such a great time.
Yeah.
So I'm looking forward to the Tomato Festival again this year, and just wanted to say congratulations to the team there. And I've been to the Juneteenth celebration and event. So just really just amazing. The community events that happen here in Reynoldsburg.
And we get the people to come out.
Great to be here.
Absolutely.
You mentioned some of the activity. I'm looking forward to coming back for the State of the City address. But I think there's just so much more opportunity, and just to really appreciate the being able to have continued dialogue with the City of Reynoldsburg. Working on lots of things related to public safety, lots of things related to complete streets and walkability and public safety and those kinds of things, and really kind of being an engaged partner. So a lot happening here. A lot of great things happening in Reynoldsburg, and we just appreciate being a partner in that work, and let us know we can continue to be supportive.
I appreciate that. And you said that after he got the invite too, which is good. So what you guys can't see at home is I have a board over here. It's a big whiteboard from my old teacher days, and I have a ton of things. It's kind of like my to-do list of all the projects, and these are the projects that are, I guess you could say, if you're using a football analogy, that are at least on the 50-yard line or greater. So these are all things on the way. So yeah, we are very busy here, but it's a lot of fun. So with that, if there aren't any other questions, our next guests I actually met at Juneteenth. I am going to be meeting with Shannon Mulligan and Audrey Hickman of Moms Demand Action. They're going to come in and they're going to speak. Next week is Gun Violence Prevention Week, and they're going to talk about their views and stands on some things. And given what I was just referring to as far as juvenile crime and the amount of guns and everything, it will be good to hear from them and what they have to say, because obviously what's going on right now just ain't working. So that's just my thought, but we're going to hear them next week, so that's going to be a good thing. I'm really looking forward to it. As far as everything else, everybody, one, stay warm. Please stay warm. Stay respectful, and as always, please put your shopping carts away, especially when it's this cold out. So hopefully everybody will be safe with that. But otherwise, have a great rest of your week, and we will see you next time. Bye, everybody.